this is a really exciting therapy study, and we rarely get studies that focus on people with stroke further down in their stroke recovery. So for us, it's about developing evidence whether this novel treatment of stimulating the vagus nerve to see if it improves arm function, if it works or not, because that's an exciting opportunity to get an evidence base to underpin our practice, but also to see if this is a new therapy that we could offer our patients following their stroke, particularly further down that pathway. And it's really looking at developing that evidence base to see if we can improve arm function and their rehabilitation potential.
It's a trial aimed at people with stroke, so people that have had a stroke between 6 months and 10 years ago. And it's looking at whether vagus nerve stimulation in the ear combined with upper limb rehab can improve upper limb function in people that have had a stroke. And specifically it's aimed at people with a stroke in the anterior part of the circulation.
The study went live in March. We've highlighted one potential participant, but certainly looking to recruit at least 9 more Cornish participants that are resident in Cornwall. We are really actively looking at our clinical caseload within our service to identify potential participants, but we're also linking in and discussing the research study with other services like our integrated community stroke service, particularly patients at their 6-monthly reviews to see whether they might be eligible. Our community rehabilitation teams are often in contact potentially with people with stroke further down in their stroke pathway, and also with Stroke Association and the Stroke Emotional Support Services that again will have contact with people with stroke throughout their stroke recovery, as well as some private therapists.
But this would be a really exciting addition if it works. So the study is looking at whether this vagus nerve stimulation plus the activity can make a bigger improvement than the things we're using at the moment.